Welcome back to the show, everyone. From the Heart and Vascular Institute at Hoag, my next guest is here to give us an overview of their specialties and a little sneak peek at what might be coming in 2026.
Yes.
Dr. Kheder,
Yes.
thank you for joining us.
Thank you so much for having me here. I really appreciate it.
So nice to have you here. I can't wait to get in and pick your brain and learn everything that you're going to tell us about heart and vascular. But first, let's talk about you. Give us a little bit of your history.
Yes. No, thank you so much for that introduction. So I'm from San Diego, grew up in San Diego, went to UCSD for an undergraduate degree, and then I did my medical training in American University of the Caribbean. It's in the island of St. Martin. Then I was fortunate enough to make it back to Scripps in San Diego, where I did my internal medicine residency. And then from there, I did more training, went to San Francisco and did my cardiology fellowship, which is a general fellowship. And then I further subspecialized and made it to Chicago, where I went to Loyola University Medical Center and did my interventional and structural subfellowship. And now, kind of full circle, went from all over, and now I'm back in Southern California, which I'm so happy to be here at Hoag, and I've been there for about 2 years.
Was that your intent when you started out on this path?
Absolutely. It was our goal to come back. My wife's from California, I'm from California, and all of our family's here. And what better place than in Orange County?
Yes. Well, you probably get this all the time, but you look so young.
Thank you.
So at what age did you know that this was the career path that you wanted to take?
Yeah, so it's interesting because in my family, I'm actually the first physician in my entire extended family. And my family is very business-oriented, finance, property management. And even at an early age, I thought I was going to follow in my father's footsteps of business. But by the time I was 14 and then I started taking biology and physiology in high school, it was a done deal for me. I was very athletic and active, and I always wanted to learn how the human body worked, and that just piqued my interest. And from there, I never looked back.
How did you zero in on heart and vascular cardiology?
Yeah, that's another good question. So my father, unfortunately, heart disease, premature heart disease, coronary artery disease runs very heavily in my family. And when I was in my undergrad years, my father actually suffered a mild heart attack, and he had a couple of stents placed. And so I always thought I was going to do neurology, but then after that happened with my father, I learned more about it. Then when I went to medical school, everything made sense in a sense from a cardiac physiology standpoint, how when you change one parameter with the body, it affects everything, and it all comes with the heart. So that's where I really took off with interventional cardiology.
Wonderful. Well, let's dive into the Jeffrey Carlton Institute, Heart and Vascular Institute. You've been with them for how long?
2 years. Yeah, so it was a great opportunity to come and join Hoag, and it's the Heart and Vascular Institute. It's an interesting institute where it comprises cardiac surgeons, which are heart surgeons, cardiologists, which I'll explain in a few moments, all the different subspecialties of cardiology, and then vascular surgeons. And the vascular surgeons primarily specialize with all the arteries that are outside of the heart and outside of the major artery, which is the aorta. So the arteries in the legs, the thighs, the feet, the hands, the arms.
Mm-hmm. Amazing. So what does the group of cardiologists treat? Yeah,
so it's good to think of cardiology as the overarching main specialty, and then within each cardiology, there's different subgroups. So kind of like if you imagine, you see an internal medicine, and then there's a lung doctor, which is a pulmonologist, a nephrologist, there's a neurologist, all these different specialties. Cardiology itself has its own subspecialties as well. So for me specifically, I'm the plumber. I tell my patients I'm the plumber. So I'm an interventional cardiologist, and I deal with the arteries of the heart, the blood flow of the heart. And
so back me up a little bit, Dr. Kevin. Does this start with the heart? So cardiology, absolutely, that's
Yes.
like the mothership.
That's exactly correct. So it's the mothership is cardiology. So you need to do further training in order to subspecialize. But in order to become a subspecialist, everybody has to be trained in general cardiology.
So you went to plumbing school?
So exactly. So I did general training, and then I went to plumbing school. And plumbing school focuses on the blood flow, the arteries of the heart. So I focus on stenting, heart valves. So, and I'll explain in a little bit the difference between a heart surgeon and an interventional cardiologist,
Yes.
but a way to fix the arteries of the heart minimally invasive. But then on the other side, just like there's a plumber, there's an electrician. So the electrophysiologist focuses on the electrical conduction of the heart. They focus on arrhythmia, so arrhythmia management, abnormal heart rhythms, atrial fibrillation, which is heavily prevalent in the United States. They focus on ablations and SVT. And then another specialty is heart failure, or so when the heart muscle itself starts to fail, there's programs and specialties developed into helping support the heart, which I can also talk about in the future about ways to help a failing heart respond.
Wow, there's so much to know.
Yes.
It's unbelievable. So tell us, what is the difference between a cardiologist and a cardiac surgeon?
Yeah, so I like to think of interventional cardiologist as a minimally invasive heart surgeon. So traditional ways is open heart surgery. So when somebody would come in and have blocked arteries, the most common way would be to do bypass surgery. That's actually where you're taking arteries from a leg or from an artery coming down across the chest, and you attach it and you bypass the blockages. That requires open heart, where when you hear they're gonna cut open your chest. So over the last 15, 20, even 30 years, there's been a big push to help treat patients without doing open heart surgery because it's very morbid and it takes a toll on a patient, and the recovery can be quite difficult. So especially in the last 15 years, the field of interventional cardiology has blossomed and actually has taken off. So we are a way to help fix the heart's arteries, to fix the heart valve minimally invasively. And even now in the last 15 years, and Hoag actually is a huge proponent of this and is a huge leader in Orange County, something called transcatheter aortic valve replacement, or TAVR. And that's where your aortic valve, which is a valve, separates blood flow in the heart. So when it opens, blood flows, closes, prevents blood from going backwards. That aortic valve starts to fail. And it usually starts to fail in patients when they're in their 80s and sometimes in their 90s and 70s. And to subject an 80 and a 90-year-old to open heart surgery is quite morbid. So we created this new procedure.
Sounds fascinating.
Yes.
How do they get it exactly in the area where they need it? Is it they send in a little scope?
Yeah, no, so that's another great question. So that's where the great planning of Hoag and the great resources at Hoag. So we have to use very sophisticated CT scanners, which Hoag has two very sophisticated scanners in order to help visualize and pre-planning. So there's a lot of pre-planning for all of our patients. What we do is we do pre-planning and we talk about their case, and we talk about it with cardiac surgeons, with interventional cardiologists, with imagers, and we talk about a patient's case. For me specifically, in addition to doing that, if I need to do stenting, that's a minimally invasive procedure. What we do is we actually go in with a catheter or a plastic tube. We go in from the arm, or we can also go in from a patient's groin, and we go all the way up into the heart. When we get into the heart, we get into the arteries of the heart, and we inject contrast or dye, and that helps visualize the arteries. So when you brought up, is it a scope with a camera? No, not necessarily. We are using angiography or fluoroscopy, which is a fancy term for X-ray with contrast media to visualize the areas that have narrowing, and we can treat appropriately.
That is fascinating.
Yes, thank you.
And the patient can get up and walk away.
Exactly. So most of these are same-day procedure. So 90 to 90% of the patients who get this procedure go home the same day. If it's a little bit more complex or more involved, sometimes we will keep patients overnight for recovery. But it's much quicker than doing open heart, which is 5-6 days in the hospital.
Oh no, that sounds so barbaric.
Yeah. No, I can only imagine. Yes.
Yeah.
So what's coming in 26?
Yeah, so Hoag is actually setting themselves up in Orange County, Hoag Irvine. What they're doing is they're developing and they're expanding because they want to provide greater access and care for a large community of Orange County by expanding Hoag Irvine. So it's been under construction. We can see in the photos in the background for the last about year and a half, and it's projected that middle of 2026, Hoag Irvine is going to be a mecca of a campus. And exactly what we're doing at Newport Beach, at Hoag Newport, we're going to be able to provide the same services at Irvine. So they're creating a cath lab, a hybrid OR. They're creating specialized areas so we don't have to now transfer patients from Irvine. We can really focus on treating patients there.
It's a lot closer to this specific area.
Absolutely. And we want to be able to provide that access and that care for patients in and around the community of Orange County, especially Laguna Woods.
Especially.
Yeah. Yeah.
Dr. Kheder, thank you so much for joining us today. Really appreciate all your incredible depth of knowledge.
Well, I appreciate you having me. I want to appreciate, and I'm honored to be here for the community of Laguna Woods. I was reading about Laguna Woods. I think it's a fascinating community, and I want to express my gratification and satisfaction, and I appreciate the opportunity here. Thank you so much.
Thank you. Thanks for joining us.
Thank you.
We'll be back after these messages. You're watching This Day on Village TV.